Next in Better Health, we find out how quality and improvement is extremely high priority for the Southern District Health Board.
My name's Tracy Hall. I'm a registered nurse in the outpatients department at Southland Hospital. My specialist area is in preoperative anaesthetic assessment of patients prior to surgery. In 2011, it was identified that there was a large number of patients that were being cancelled day of surgery due to being unfit for anaesthetic. So the Ministry of Health funding was gained to develop a project to look at reducing those cancellation numbers. So it was a collaborative project between another number of departments. With this pathway, the patients are still seen by their surgeon at their first specialist appointment. They'll be deemed to require surgery. We actually step in and work the patients up right from that point, so before the patient is actually placed on a surgical wait list. If there's any underlying health problems that we identify at that stage, we then support that patient to become optimised prior to their surgery, rather than wait the 6 months and then find out that they've got a problem that needs to be corrected. They see the surgeon, their wait list is then forwarded to a nurse-led clinic, so there is 5 of us that undertake this role. We've all had advanced assessment and diagnostic reasoning postgraduate papers, which we've completed as part of the prerequisite for this role. All patients get a health questionnaire, which the patients then complete. We triage those health questionnaires. So what we're looking for is any what we call red flags. So anything that could potentially stop that patient from going forward for their surgery. From the triaging, we determine a pathway for the patient. So we have 3 pathways. So patients could be fit and healthy, they've got no underlying issues, they automatically will go on the surgical wait list. Our second pathway is that they may have, 1 or 2 underlying problems. So they'll have high blood pressure, for instance. They may have diabetes, and their blood sugar is not as well controlled as it could be. Mm-hmm. So what we do is we'll order blood test or an ECG, so we're tracing of the patient's heart. We then follow up on those results and determine if they're fine to proceed to surgery, or whether the patient may need a bit of optimisation. So in that case, we would refer them to their GPs, the general practitioners, and also our clinical nurse specialists in diabetes here for management, to optimise their blood glucose levels. Our third pathway is the patients have quite complex underlying issues, or they may have a significant new problem that we've been able to determine that the patient wasn't aware of before. We will then work them up in a face-to-face interview. So we do a full assessment, so we incorporate doing, listening to, heart, lungs, those sorts of things. We arrange diagnostic tests, so bloods, ECG again. We follow those results up. If the patient needs optimisation or referral to a further specialty for more in-depth assessment, we arrange all that. Or it may be that the patient is really quite complex and we need to bring them in to see an anaesthetist, who will then sort of take it from there in determining whether the patient is fit to go through for their surgery. It's been a fantastic project, and we've seen some huge health benefits. Day of surgery cancellations have reduced remarkably. We have got, everyone is following a standard process. Cancellations affect not only the patient, it affects the organisation. Cost-wise, it's a huge cost to family. and friends, because family and friends have to be organised to look after their patients, or look after the patients once they're discharged from hospital, and if they're cancelled, it actually has wide-ranging effects, not just on the patient. Through this process, it's been very successful. It's been well received by the patients, and it's shown excellent results. At the time that we implemented it, there was 3 DHBs in New Zealand that were utilising this pathway. That is now, there's more and more rolling out all the time, and it's just becoming accepted as a standard pathway because it has such huge benefits for both patient and the organisation.